Starting with the name of Allah, who is the most merciful and the most beneficent. Assalamu alaikum. Welcome to my YouTube channel The Smile Squad. Today we will explore about the topic oral malodor. Oral malodor is commonly called halitosis. It is an unpleasant or offensive odor originating from the oral cavity. It's a widespread problem affecting nearly 1 in 2 people at some point in their lives. Although often seen as a minor social issue, halitosis can lead to emotional distress, low self-esteem, and even social isolation. Importantly, halitosis may be a sign of poor oral hygiene, but in some cases it can indicate serious underlying conditions such as diabetes, liver or kidney disorders, or respiratory diseases. Therefore, identifying the type, cause, and appropriate treatment of halitosis is essential for both dental professionals and medical practitioners. Halitosis can be caused by a range of factors including poor oral hygiene, gum diseases, dental caries, systemic diseases such as diabetes and kidney diseases, medications, hormonal changes, and certain foods and drinks. Classification of halitosis based on etiology and based on patient's criteria. Based on etiology. According to its cause, halitosis can be divided into 3 main types. Genuine halitosis, the malodor is objectively present and detectable by others. This includes physiological halitosis and pathological halitosis. Physiological halitosis due to the natural reasons like morning breath or fasting. Pathological halitosis caused by diseases either oral or systemic. Pseudohalitosis. This patient believes they have bad breath, but clinically no odor is detected. Halitophobia. Even after treatment or reassurance, the patient remains obsessed with the idea that they have bad breath. This is often related to psychological or psychiatric issues. Classification based on patient-oriented types. Another way to classify halitosis is by its origin from the patient-centered perspective. It has 5 types. Type 0. No halitosis is present. Type 1. Oral cause most common up to 90%. Type 2. Airway related. For example, tonsillitis and sinusitis. Type 3. Gastrointestinal source, for example GERD or H. pylori. Type 4. Blood-borne halitosis, for example diabetes, liver failure. Type 5. Subjective halitosis or psychological origin. Pathogenesis of malodor. The main mechanism behind oral malodor is the breakdown of proteins by anaerobic bacteria in the mouth. These bacteria digest food particles, saliva, epithelial cells, and blood, releasing gases known as volatile sulfur compounds or VSCs. The most important VSCs responsible for bad breath are hydrogen sulfide, methyl mercaptan, dimethyl sulfide. These compounds give a characteristic rotten egg or cabbage-like smell. The highest concentration of bacteria responsible is found on the posterior dorsal surface of the tongue, where saliva stagnates and debris accumulates. Etiology of halitosis. Now let's look at the causes divided into physiological and pathological. Causes of physiological halitosis. This is usually temporary and not related to any disease. Causes include morning breath due to the reduced saliva during sleep, hunger or fasting, which leads to the increased breakdown of proteins, consumption of odor-causing foods such as onions, garlic, and spices, smoking and alcohol use, dry mouth temporary due to the stress, dehydration, or speaking for the long time. Causes of pathological halitosis. It is divided into 2 parts, intraoral causes and extraoral causes. The intraoral causes account for 80 to 90% of cases. It includes tongue coating, thick bacterial biofilm on the tongue dorsum, periodontal diseases like gingivitis or periodontitis, dental caries, poorly cleaned prostheses, dentures or bridges, oral infections such as candidiasis, ulcers or abscesses, dry mouth, xerostomia from medications, Sturgeon syndrome or radiation. Extraoral causes, ENT causes, tonsillitis, sinusitis, nasal polyps, post-nasal drips. Gastrointestinal causes, GERD, esophageal reflux, H. pylori infection, respiratory infections, bronchitis, lung abscess, systemic causes, diabetes, fruity smell from ketones, kidney failure, ammonia-like smell, liver failure, musty or sweet odor, trimethylaminuria, rare genetic disorder causing fishy odor. Diagnosis of halitosis, clinical evaluation, organoleptic method. The examiner smells the patient's breath directly and rates it on the scale of 0 to 5. Tongue and oral examination to check for coating, plaque, periodontal diseases. Instrumental methods, halimeter, a device that detects volatile sulfur compounds, gas chromatography, highly accurate, separates and identifies different gases. Bana test detects enzymes from bacteria. Salivary test to assesses the flow and pH, important in dry mouth. Treatment and management of oral malodor. General measures educate and motivate the patient, regular hydration and chewing sugar-free gum to stimulate saliva. Oral hygiene measures. Brushing twice daily including flossing, tongue cleaning, using a scraper or tongue brush. Use of antiseptic mouthwashes, chlorhexidine, zinc-based rinses, neutralize sulfur compounds, essential oils, Listerine. Dental treatment, scaling and root planning for periodontitis, filling of caries, removal of plaque and calculus. Treating systemic causes, referral to ENT for sinus or tonsil issues, gastroenterologist for reflux, endocrinologist for diabetes related breath, nephrologist for kidney or liver problems, psychological management, counseling or referral for patients with pseudohalitosis or halitophobia. Cognitive behavioral therapy can help in these cases. Social and psychological impact. Bad breath can lead to the social embarrassment, low confidence and anxiety. It's important for the clinician to handle the topic sensitively and supportively. Preventive tips. Avoid odor causing food, quit smoking and alcohol, maintain good oral hygiene and stay hydrated. Recent advances. Use of probiotics to balance oral microbiota, development of breath analyzers and smart sensors, studies on the oral microbiome and its role in halitosis. Role of the dentist. Dentists play a key role in identifying and managing the halitosis. They must also refer to specialists when non-dental causes are suspected. To summarize, halitosis is a multifactorial condition that can be effectively managed with proper diagnosis, good oral hygiene, and multidisciplinary care when needed. Addressing halitosis not only improves a patient's oral health but also boosts their overall confidence and quality of life.